Can you believe that these guys got the Stones to sue our man for standing up to the tyranny?
Stones. I'm surprised they didn't do it sooner.
Johnny, what's the latest?
The latest is they're coming after our guy for refreshing the people on the ACIP. There were a lot of conflict of interest, so that was part one of it. And then part two is, no longer recommending the COVID vaccine for pregnant mothers and for kids that are healthy. And I think that's just wild because I think the science is. What's the gold standard? Randomized control trials. Where's the proof that they're going to bring? Because I think we got a lot of studies on the other side that show that these shots are dangerous.
Yeah, so it's fun. Someone just shared with me a little bit ago Lauren Lee's thread about this, and her narrative, and I hope it's the real one, is these lawsuits are essentially falling right into Bobby's trap, because lawsuits involve discovery. And Bobby's in the position to generate enough medical studies to prove that they've made the right decisions, but maybe even prove malfeasance. And they were the ones that brought it on themselves by filing these lawsuits.
It reminds me of Oscar Wilde. He's a good author. He got himself in trouble for suing somebody who slandered him. So yeah, we'll see how it goes.
Yeah, I like Oscar Wilde. One of his quotes: "If you're going to tell people the truth, make them laugh. Otherwise, they will kill you."
That's powerful.
So on tonight's show, we're just gonna riff for a couple minutes about what's taking place in Maha over the last week. Today there was some action too, and then we're gonna have Amber and Frank from Burst IQ, and the title of the episode: Healthcare System Upgrade. And so this is a really, really interesting platform. I'm not going to get into it right now, but this is a topic and a discussion that I've been looking forward to having for months, and so we're going to really explore the opportunity for to Maha and how technology can be our friend in doing it, and we'll get into that. Billy, you helped facilitate a big call today. What was that all about?
So that was Maha Action, kind of their debut as it moved over to Tony Lyons and Mark Gordon. They're running Maha Action and working with Maha Institute, and just kind of debuting a whole new way to look at Maha and a whole new way to promote health in America. So while the lawsuits are happening, and we definitely talked about that, they brought together just a great lineup of speakers today. Stephanie Spear, Deputy Chief of Staff, HHS, Tony Robbins, Callie Means was on, Russell Brand, Dr. Robert Malone, Bonnie Hari, Dr. Eric Berg, Dr. Gary Brecka, Asima Lorta was on, Dr. Asima Lorta. They all got to speak. It was about an hour and a half call. And this was the first call in a bi-weekly call. So every other week they're going to do this call. And the goal is to really kind of hone in on what I think a lot of us have been missing in this space. I'm a newbie in this space. I mean, I've been gradually getting more and more into this space. But when I landed on the Kennedy campaign in 2023, health, COVID vaccine, forced mandates, closing down businesses, stopping the events that I was keen on doing as my career. All of that brought me to this space. So I'm relatively new to this space, but there's people that have been in this space for 20, 30 years. And if you really look at the hierarchy of the space, you've got the stuff that's coming out of government, and then there's a complete and total disconnect with what's going on at the federal level in the hierarchy of government, and what's going on at the state level with the activation of legislation that really sets the course of our democracy in this republic. And so that disconnect is what Maha Action is really focused on trying to bring together the thought leaders and the doers, the people that are visiting the state houses, visiting the governors, visiting the legislators, talking to Congress and Senate, working on the actual legislation. And when you dive in, it's like 300 people. It's like really like 300, 400 people that are really active and really doing a lot of the work. And then 100, 200 organizations that are really working very hard. A couple weeks ago, we had Allison from Health Action Massachusetts on. These type of state leaders, Candace Edwards from Massachusetts couldn't be on that night because she was working feverishly on potentially losing their religious exemption, which is coming up in a week or two. So it's really to bridge that gap between what's coming out of the federal level, what their mission is, and really kind of putting together the Army so that we can really become a major force in this country. Not that we aren't already. I think the Maha clan, the Maha team, the Maha group, the Maha warriors, as Maha Action is calling it, they're coming together in a new way. And this call was the first call that kind of set the stage for this communication, which is not just top down now. This is now group level. This is now holding hands and really coming together to make a difference on a massive level. So it was a great call. It's a great first call. Tony led the call, Tony Lyons, and it was great.
It was a great call, man. I'm glad you sent me that link. Some really great speakers. When you talk about this movement, only really when it comes down to it being like 300 very active people, that's movements for you, man. And the question is whether those 300 or whatever number of people are organized enough for the action to pile up and tip the scales.
And when I say 300, that's really just like, I'm talking about at state level doing some really hardcore. Of course, there's like, Ranch Mama and the guy from Farm Mat. I mean, there's thousands of people that are working on their own thing.
Grassroots organizing in any given location tends to be a handful of hardcore. And if they're doing their gig right, they make it easy for thousands of additional people to just put their finger on it and speak through those really hardcore people.
It's fascinating to see them work. It's the coolest thing about this is getting to link people up. Odette from the National Call for Safe Technology is currently working on a 90-page document on the serious implications on smart meters. And so another gentleman from Farm Match who runs Farm Match reached out and said, "Hey man, when we were just talking, he told me he's having a major issue with 5G or with smart meters, and they turned his farm off right before July 4th because he wouldn't get the smart meter." So, one of the cool things about this group that we're growing is this ability for a lot of us to start knowing who all the players are at the state level. So, and there's middleman. So it's just like Odette, meet Max, boom, and they're talking, and now they're, we can really get some work done and share resources. So I think that's probably one of the coolest things about what I'm seeing in Maha Action is this ability to see who's doing the work and the ability for everybody to kind of work together the same way, big pharma and, the big organizations are coming after us at the state and federal level. We're now starting to be able to work like that. It's amazing to see.
Yeah, and that slate of speakers really gave some great context across the movement. And when we talk about all these like state leaders, Vani Hari, Food Babe, who I've been following for like 15 years, she's so rad. She's been doing a ton of work at the state level, having to do with the toxicity of our food supply. And she made a really valid point. I'd be curious if this applies to other issues. It probably does, but particularly when it comes to food regulations, the last thing major industrial players want to see is a patchwork of state policies. And so what happens is, I know a lot of us get frustrated when we don't see things happening immediately at the federal level because our guy got in. And the thing is, when you start making that impact at the state level and suddenly you got 5, 10, 15, 20 different regulations at the state level, those industrial players will end up begging pretty much for a federal level standard just so that they know what they're working with. And so all these state victories we're getting create the framework, the foundation to get a big win at the federal level. And that takes time. It takes work. But we're doing that work. And again, like you said, we're connecting all these state leaders and all these organizations. So now we just got to figure out who's fired up where about what, empower them to score a win, and then make sure that that creates momentum into the next one.
That's the plan.
That's the plan.
Come on. It's about time, isn't it?
It's
Yeah.
always time.
Really
Yeah.
feel like a movement's building, which is great. It just really feels like a movement is actually coming together and the numbers are growing.
Yeah. Now, Billy, pay attention. Since you've got the inside view here now, and you have for a little while, watch how being on the inside, it feels one way, and then watch the narrative in both the press and in social media sentiment, and how often it will not look the same. But with your inside view on the potency and competence of the people doing the work, you will know that victories are coming down the pipe that no one else would know if they're just listening to corporate media or even social media noise.
What's interesting is, like, I think we're all going to be on the inside now. There is no, I don't think there's going to be any gatekeeping anymore. I mean, what we're really pushing for is for all of us to have a seat at this table and talk.
Yeah. Well, I mean, it's a selection process, though, because there's a ton, millions of people in this country that want us to win, even if they don't know we exist, who will only get, again, corporate media and social media sentiment. And social media sentiment is gamed as much as any other means of communication. They will try to flood the airways, as it were, on Twitter and Facebook, etc., with all sorts of noise. And there will be a dissonance between what you hear there and what we've got going on, at least until you start seeing critical mass.
That is
I
true.
think we've seen that, though, haven't we, Dama? I mean, I can't believe how many so-called health influencers I've seen say, "Oh, Maha is dead." It's like, our lives are on the line. Whether it's a little bit or it's a Holocaust or a genocide, like a lot of us believe, our lives are on the line and they're being taken from us. And for you to say Maha is dead, it's like, what is that? How is that helpful? It's like, we need all hands on deck. We need to come together.
Yeah.
We're all on the same team here. And whether we see things differently, you mentioned so many great names that were on the call, Billy. Rob Schneider was there, and that was something I was talking about.
I
Is,
forgot about that.
coming together, and all of us,
Mhm.
we're all on the same team here. And,
Yeah.
we may see things a little differently. And, Robert Malone was talking that, he was asking for forbearance. He's up against, they're up against some of the, the most entrenched, evil, powerful entities, maybe, in all of human history. And they're doing their best, and they're getting some wins. They're getting a lot of wins.
Yep.
And they got to go slowly. And this lawsuit this week is evidence of that. You got to do it strategically. So,
yeah. And he went out of his way to say that he's got an embargo. He's not allowed to talk about the plans they've got coming down the pipe. And he wouldn't have said that unless there were things he wished he could tell us. You know what I mean? There's stuff in the hopper. So yeah, and going back to this influencer thing, right? First of all, we need to remind ourselves that influencer does not mean genius. It does not mean strategist or tactician. It also doesn't inherently mean values alignment, right? Regardless of the topic they're talking about and how they usually talk about it. And then you have to remember that the algorithms tend to reward things that will get attention, controversial statements, and the sense that an influencer needs to say something to stand out, or have their little bully pulpit that they don't actually they're not actually accountable to anybody for that bully pulpit. So they'll say that, oh, he did this thing, so it's all over, it's all dead. He's not taking any real responsibility or leadership or ownership of the movement. There's no gravitas there except for the perception of influence. So we got to be careful with influencers, and we should also reach out to them. The Rob Schneider's message was essentially, we need to, with kindness, remind people that care matters, and that what we're doing matters, and sort of get this inflammatory nonsense out of here.
What we do matters. And for those who missed the call, I would encapsulate the main message as, use your voice. We got voices. We got to use them. Keep on supporting the cause, and amplify the message that, we're all in this together, and, we're behind this movement. So,
yep. I don't care what we call it, frankly, but I do love Maha, and I love all my folks in Maha. You are muted, my dude.
Kyle, we can't hear you. Use your voice, brother.
All right, folks. And when's the next call? Do we know?
Bi-weekly, every other Wednesday, 4 p.m.
Wednesday.
every other Wednesday, 4 p.m. Eastern.
You know, and I got an email from that by signing up at the Maha Institute. I believe that's where I was signed up at to be.
Is that an open call, Billy? Anyone can join that?
Because
Yeah,
I
I mean,
did
I think
get
it
a.
maxes out. I'm not sure what the number is.
I think
Okay.
if I had to
Yep.
guess, it's maxing out at 500. But you know, if you sign up at the Maha Institute, you know, I got an email for this week, and then you know, I did get a survey afterwards as the Zoom call ended that they're kind of open to moving around the call, trying to ask when the best time would be. So, yeah.
Okay.
Any feedback, like, about how to improve it based on the calls you guys saw today?
I got something, Kyle. Are you guys ready?
So here goes.
More calls to action. Where's all the petitions? Put all the links in the comments for those who really want to, you know, put a little time in. You know, what are we sharing? You know, there's been a lot of great documentaries that have come out recently that I think could have got a little more traction. Follow the Silence by Mickey Willis. We're talking about Toxic Nation by Jeff Hayes. We're talking about The Agenda. This was a really great flick about the agenda of tyranny that's encroaching upon us. So, you know, these are important films to keep sharing. So.
You know, it's interesting when you do something like this. A lot of people come out of the woodwork with a lot of ideas. Some are a little harsh, but you know, for me, when you have something like this happen, it's just the first step. So you know, Johnny, like what you're saying, all of that's coming. So we in those calls, it's like, what are the things, like as we're leading up to that call, what are the things that can be done, and giving people the tools that they need, like we tried to do when we were working on the Kennedy campaign. It's kind of that idea. And I look at it like when you're doing marketing. When you're doing marketing, the worst thing that can happen is you get like a little article over here and 30 people see it, and a little radio ad over here and 1,000 people see it, and you miss the TV thing because no one really heard about it. And then you know you're in the mall and you meet someone and they do a podcast and it's on for 50 people. The best thing that can happen is when everything hits in the same week, and instead of hitting 1,000 people for a week for 10 weeks, you hit 22,000 people in 1 week, and that cuts through all the clutter, and everybody starts to see and hear what the message is. And so that's kind of what I'm taking away from this, is that this is just kind of the first call with the first kind of, here we are, here's what's coming. And then every 2 weeks we'll get a little bit more in depth. If you can think about a brand like this and getting, you know, keys to all of the stuff and the Maha brand, and, you know, the communication to the Maha warriors, there's a lot of stuff that's getting ready to come. There's a lot of paraphernalia. There's a lot of papers. There's a lot of links. There's a lot of movies. There's a lot of data. There's a lot of signage, content that you can share. So that will be part of this coming up. Is after the call, here's what's coming up right now. Here's what's coming out of HHS. Here's some of the things that we're working on. Here's some of the things that you can go download in our website right now. Here's the link to that. Here's what we'll be talking about in 2 weeks. So I do think that's coming. One of the things that we did here is people wanted two-way communication. That's really hard to do with these numbers. So I would imagine they're going to pay attention to all of the feedback that we're giving after the meeting's over. You can type your questions, you can type your stuff, and then there's a team of people reading over that.
There were some all-stars in the comments. I was just scrolling through the comments. Oh, look at her. She's here. He's here. They're there.
Like downloading those comments too. Like when we were running those big Zooms, like during the campaign, like, my gosh, the chats were so active, and like, you know, just asking people, like, you know, people were throwing it all in there. There's so much data in the community. Like, you know, sometimes, like, you know, the celebrities or the big energies, they're amazing, but like the power within the community and the intelligence and the questions and suggestions, you know, it's good to look at all of that. And, you know, and the awareness and the calls to action, the mobilization is critical. And I kind of want to segue this in because, you know, it's also about upgrading and solutions. Like, you know, the ideating on policy is one bit, but actually driving solutions and being aware of some of the solutions that we have out there. So I'm going to play this intro video for Burst IQ to just give a little bit of an overview, and then we're going to have Frank Ricotta, who's the CEO, and Amber Mortensen, who's the head of strategy, to come on, and we're just going to riff and kind of go on. But let's just start off with, let's see how they present this to the world, and we will play from there. All right, 1 second. Boom, boom. Hold on. Right there.
Data is everywhere, but that doesn't mean it's helping you achieve your goals. Data is often riddled with complexities that hold you back.
So what if there was a way to unlock its true power? Imagine being able to connect any data from any source, tackle all its complexities from a single platform, and turn your entire data ecosystem into a trusted source of truth that can help you achieve remarkable business results. Introducing the new and improved LifeGraph from Burst IQ. LifeGraph delivers true data integration driven by intelligence, so you can get more value from your existing systems quickly and cost-effectively. The platform embeds context and infuses trust into each data asset. It's what we call smart data, and it provides you peace of mind that all your data is secure and trustworthy. With LifeGraph, you can build a data fabric that helps you automate processes, ensure regulatory compliance, and promote collaboration across your entire business. LifeGraph's unique combination of features replaces the need for multiple vendors and long development cycles, freeing your team to focus on initiatives that deliver the most value to your business and to your customers. See your data like never before. LifeGraph uses knowledge graphs to reveal connections and patterns in your data, unlocking deep insights that may get overlooked in traditional data management systems. When you turn your data into LifeGraphs, insights are more precise, AI is more powerful, innovation accelerates, and you can deliver tailored solutions to meet the unique needs of every customer. So, why wait? Dream big with LifeGraph. Contact us today to see LifeGraph in action.
All right. Please welcome Amber and Frank.
Hey guys,
How you doing?
Hey guys, welcome to the stage.
Welcome.
thanks for having us.
Thanks for being had.
Happy to be here.
Oh, guys. So Frank, I mean, we had the opportunity to share a panel at the Mega Maha Crypto Summit during during the inauguration weekend, and that was really great. And we were kind of like touching, and that video that we just saw, I feel like that was kind of like the business kind of case.
Yeah, that's the corporate message.
That's the corporate, but I think the applications of it, when you think of it instead of a business, but at the system level, at the federal, at the government level.
Well, back up. I mean, if you back up and understand the premise of why we started it all, we started in health. We got a lot of business in health, but the fundamental premise is really kind of multifold. It was one, we think people should own their data, show them their digital personas. And when you look at LifeGraph, we view LifeGraph as digital DNA of you. It's your data, right? And so with all this new stuff coming out, between things we wear, things that watch us, data we put in about our health and our wellness and our overall mental well-being, we're at this really cool convergence point that, we're at the stage where everybody's about ready to have a little health buddy that's personalized to you based on who you are and your lifestyle and what you want to be. And all these cool things we've been talking about and listening to you guys talk about in the Maha movement all starts coming together in a way to help somebody live a better and more healthy life. And we've always believed in the power of data transforming human experience. And I think it's no different. I mean, our healthcare system today is so messed up, it's so fragmented. You got all these corporate immune systems kind of blocking people's access to their own information, to help them live a better life, to get access to the care they need, to understand how to be more proactive in their health, and homeopathic solutions, food-based solutions, all that's out there, but it's so fragmented and hard to get to. It's really time, to make this a leg in the stool in the broader Maha movement, not only just policy and what we're doing, for clean food and clean water and all that good stuff, but also what we do with who we are and who we are, in our data footprint.
And
I have a
so-
question, Frank. Can you break down? Like, I watched the corporate video, and I'm hearing what you're saying. Can you tell us who your core clients are, and how my family are going to benefit from
Sure.
like what you're offering? Like, what exactly is your core, your core product that you're selling, and how can I benefit with that with my family? And is it something to the tune of being able to kind of safeguard my data and lock it up and kind of control it a bit more? Is that what I'm hearing?
is this like, is this the own your data kind of, concept?
It sure is, but you gotta say where we started. We're small, so where we started really driving it at more of an institutional level on how you kind of build it from the bottom up and drive that control out to the person, kind of in a decentralized manner. So our broader vision is everybody has a life graph. They own their own life graph, and it really kind of powers the interaction between people, particularly on the health side. So our core customers right now are we do sell to Medicaid solutions in their modernization efforts to build more holistic profiles of the people they serve and how they can serve them better. We sell to some of the pharma institutions, not to, I'm going to say in a good way in terms of how we leverage AI to better support who we are as people and use better products and cleaner products in terms of getting them through. And we sell to higher ed institutions. It may sound like, hey, that's a tangent. We build this life graph, which is that profile of a person. And part of being a person being healthy is feeling that they have something meaningful to do and who they are and what their skills are. So we work with higher ed institutions to let people connect with their own skills and skills development and person development. I don't have a consumer facing product. We're sort of a plumbing behind a lot of consumer products right now.
Billy, one way to sort of think about what Burst IQ does is fundamentally, when we really think about like what it means to manage a person's data, we're sort of seeing this trend from, the 2000s when big tech companies essentially own all of our data. All of our consumer data is owned by basically 5 big tech companies. And it's there's this trend both from a regulatory perspective and from a consumer demand perspective to push all of that ownership directly to people. So people have direct ownership and control of their data and can make decisions about how they want that data to be used by the various different businesses that they interact with. And so we're sort of in this transition period, this evolution, where we're kind of in between big tech companies still needing to have access to data, and especially in healthcare, for example, if you show up to an ER and you're unconscious, you don't have the ability to consent your data to the attending physician in the ER. So there have to be mechanisms in place for those providers to be able to access your data when you can't tell them, I want you to get my data so that all of my, all of my record. But eventually we'll get to a point where consumers, patients, have direct ownership and control of all of their data assets and can really make informed decisions about their own care because they have not just this like massive amount of core data that frankly most of us never really look at or really understand because we're not healthcare professionals, but if you can contextualize that data and you can provide insights and you can bring that data together with all sorts of other information about randomized trials and what works and what doesn't and what's been proven and what the science says and where there's ambiguity in the science, that becomes incredibly powerful for giving people really useful, contextualized, accessible information that helps them make decisions for themselves and really take ownership of their own care. And that's fundamentally what LifeGraph helps you do. It's the back-end brain system that brings all of that data together and builds it into these knowledge graphs and says, okay, I know who Amber Mortensen is, and I know everything about her from a healthcare perspective. And I know that she's interacting with these apps and that she has consented data to this app, but not that app over there. She's made all of these decisions about what kinds of products she wants to participate in and share data with. And then that algorithm can say, wait a minute, how is she similar to and different from millions of other people? And what worked for them and what didn't work for them? And I can find those insights and those correlations in the data without violating anyone's privacy in the process. And that's really the power of what data and knowledge graphs can do.
Very cool. I have a question on, does any of that get into, like, one of my biggest issues with healthcare has been the billing system. I'm sure everybody here and probably most people have listening have gone to a doctor, gone to do something, and been told one thing about billing or copay, and have that portion of the data be completely off. In fact, I listened to a serial entrepreneur by the name of Alex Ramosi, and he covered this aspect of a person that just focused on billing with Medicare and helped small practices bill so they could get the right codes and actually make more money. That aspect of the data seems kind of off, the flow of it. Is that any part of the system, or is that kind of separate to what you guys do?
I think that's a key part of the broader system where the problem is, some of the background was, my background, I worked on what's called revenue cycle management system, which deals with the billings and pre-authorizations. And a lot of the payers just make it hard on purpose because they want to pay. They don't want to provide transparency, even though we have all these laws and rules about transparency. You go to hospital A, pay Y for a procedure, and right down the road's our outpatient clinic, and it's 20% of that, but they don't tell you that. It's extremely frustrating from that aspect, from a person aspect and access to care. It has to be part of it. That whole transparency aspect really has to come forefront. And we were talking about this a little offline, is that, when you look at the broader Medicare, Medicaid system, there's $100 billion a year you're just in misappropriated payments. And what does that mean? People getting paid twice, are getting charged twice. And there's IDs are used in multiple times across the system. So if all we did was solve that problem, we'd save $100 billion a year. And then you add to the point of deduplication of records at the state level, it's another 200 to 400 million per state per year to get the cost out of the system. And part of that's transparency. There's so much overhead in the billing and the payment cycle. It's absolutely mind-boggling when you look at it. And so, yes, that has to be part of the solution. That has to be part of kind of an HHS-driven solution down. You were talking about state level and implemented at the state level, but it's very fragmented right now.
Mm-hmm.
And right now, like, you are doing work at the state level, right?
Yes. And
go ahead.
One of the things that they struggle with a lot of these fraud, waste, and abuse challenges. And one of the big reasons why they want to modernize their systems. So CMS is actually requiring states to modernize their systems. And that is great. That's a very good thing. But they want to do it anyway. They have big incentive to do this because they know that there is, sort of, for lack of a better way, like, we know what we don't know. And they're all in this situation where they understand that their data is inaccessible, really messy, in some cases, really bad quality, really high duplication rates. So they're really hampered in their ability to actually understand and sort of discover where fraud and waste and abuse may be happening in the system. And so a lot of that is really, okay, how do we start to really understand our data, clean up our data, deduplicate our systems, start pulling savings and waste out of those systems. And then we can really start to optimize and really understand, okay, how do we really support people? How do we support people in whatever their personal goals may be? They may be looking at, how do I incorporate more organic food? Can I use my SNAP benefits for organic? We were talking about this offline. How do I buy more organic products? And how do you make that accessible to people? All of those kinds of decisions are really data-driven decisions. And so states are very interested in trying to understand how they wrangle their data, how they get it out of those silos, how do they pull it into high quality mastered knowledge graphs so that they can start getting that insight and making more data driven decisions.
Yeah. And for a person, what do I owe? Is my real copay, or do I have to wait till the 10th bill to figure it out?
Yeah.
And then there's also a notion too, I feel like data is valuable. And right now, our data, my data, I don't own my data. I don't have control over my data. If I did have control over my data, I could potentially earn from sharing. And, having studied and been quite close to the digital identities like realm, which a lot of people hear the word digital identity and they get scared. And I want to say there's two types. I'd say there's two kind of buckets of digital identity. There's the centralized, the government, the corporations, the Microsofts own your data and rule your data, and they hold it. And you don't have it, and they get to share it and profit off it. Versus you own your data, and you can actually repatriate your data, and you hold the keys to your data. Because, and this is like this word like self-sovereign digital identity is one of the terms that's being thrown around. And what it means is, we can have our medical records and our driver's license and our insurance and our titles and our car registrations and your college diplomas and degrees and your doctor's certification, your nurse certification, your potentially your dog walker reputation, your reward points for Starbucks. Like, all of these are different elements that you can store within, your own digital wallet, let's say. And when you interface with other people, you only share what's needed.
Right.
And like an example is if you enter a bar, they ask for your ID. They're not asking for your ID to see whether you live in Florida or live in Colorado. They're wanting to know if you're over 21 in America, over 19 in Canada, and 18 in Quebec. Like, that's all they need to know. And so with this, like, there's the opportunity to just give them a straight answer saying, yes, I'm over this, without giving them your name, your date of birth, your all sorts of personal, what's it called? It's personally identifiable information, PI.
Yep.
Yeah, PI and PHI on the health side.
Yeah.
So,
Yep. Sure.
I mean,
Is this what we're kind of like? It feels like this is the core tech that's going to underlay it, and
Yeah.
from
And I would say from a regulatory perspective, it's going to take regulation at the state and federal level that we're starting to see to really push ownership of data to the person. So right now, HIPAA does not require or does not have a provision that people own their data. Under HIPAA, all that's required is that you have to keep people access to their data.
In fact, there's only 2 states that say people can own their data.
Correct. And so what we're seeing is the starting point of consumer privacy laws that are starting to push ownership closer to the individual person. And the more those start to take hold, and especially when we start to see that type of regulation at the federal level, I think, Kyle, you're going to start to see a lot of this really kind of kick over into high gear, and people really, really will be able to take true ownership of their digital identity. And, instead of, businesses making decisions about how they want to market to me, essentially based on the data they have about me, I'll be able to opt in, and I'll be able to say, if you want data about me, you can give me value for that. That might be financial value. That might be value from an app that I want to, interact with in my phone. I can define value in any number of ways, but I own it and I get to make that decision.
Yeah, it's a pretty interesting paradigm we might be moving into. If we own our own data, you can sort of start abstracting away the data layer from the application layer.
Correct.
And if you use, I'm sure you guys are familiar with the term zero knowledge proofs.
Yep.
Correct.
You can start offering data generally.
What's zero knowledge proof?
A zero knowledge proof, I will probably explain it very poorly, even though I have a general sense of what it is. It's essentially the ability for someone or something on one side of the equation to get information that they need for whatever they're doing without identifying the person necessarily that it came from.
For example, are you over 21?
That was pretty good. Well done.
That was pretty good. Great.
Yeah.
Great. Okay. Score 1 for Damo. And I find this really interesting on the medical side, just to keep it Maha relevant here. You could start doing really incredible medical research anonymized.
Yes.
Basically.
100%.
And interestingly enough, I know this was a really controversial conversation we had a couple of weeks ago when Bobby was talking about wearables. If more people, many more people are gathering someone's got a hot mic, are gathering a lot more data, health data, real-time metrics about their own health, and can then share that anonymously for the purpose of things like studies. That's really
someone's mic. There's
someone's got a hot mic.
Someone's doing something there.
Yeah, and I find this prospect really fascinating and very important. It's also potentially really nice for advertising, right? Because right now it's Google, it's Facebook, it's Twitter, it's all these companies, and they've got all your data, and then they sell it to the advertisers. But if it's zero knowledge proofs and it's and there's a safety layer there, then I, as a company, can say, hey, I want to advertise to people. I want it to be highly targeted. I want to make sure that it reaches people that actually might want and even benefit from my product. And I never have to get your information in order to reach you, because you've already self-selected your preferences to show that you would actually like to hear from me. It makes that whole advertising market, which right now is very parasitic and gross, a lot closer to what I might call virtuous.
Yeah. And it's getting disrupted with a lot of the push of, right to be forgotten and all that stuff. All that stuff, again, you're exactly right, is again, how do I own my digital persona and how it interacts in that world and how it interacts with even AI? Because I think these companion AIs or the agentic side start to put context to all that data. There was one of the premises that we're going to have all these really cool things, COVID, whatever you say about COVID, it got used to say, hey, I could test myself for things. And so now there's going to be all these cool tests that allow me to understand me better. And, I wear a blood sugar monitor. It gives me 7/24, so I know what's happening. If I eat something I can adjust that's inappropriate, I can adjust. All those things are really cool, but I don't want everybody to have all that stuff.
Right.
But to your point is, there's so many breakthroughs that are going to happen from bench research on data and the transparency of the data. That whole clinical research side is so fragmented as you go between the various trials from each stage of the trials and how you track that. Opening up that transparency, and we're seeing this, you guys were talking about some of the COVID vaccines, we're seeing that in the lack of transparency that happened there that should have led to different kinds of decisions. And in fact, when we were dealing with that COVID window a while back, we're sitting there and everything just focused on that. So we just started grabbing a whole bunch of public data and made it available to a lot of researchers. And what we found was, in parts of the world, all these alternate treatments started reducing infection rates significantly, but were getting seriously suppressed here in the U.S. But that data doesn't lie. When you're talking about tens of millions of people on these protocols and what happened to the contraction rates, it's amazing. And I think that's part of what's been the push, with Secretary Kennedy is to really open up this transparency. Let's just get it out on the table. I think that's so key in so many different ways.
Mm-hmm.
Let's talk about the transparency there just for a second, because the transparency aspect of this also has the Big Brother vaccine passport aspect to it as well, and that is one of the reasons why I got into this movement. And that's one of the things that I was a one issue voter. And that's what it was. So on that transparency side, it would seem to me that if we saw that in COVID and they came after vaccine passports, and you're telling me there's this transparency, let's call it a medical pool of transparency where there is a cohort that a group of data could show certain things. Do you foresee anything negative coming down the pike towards someone in a company like you that is a full front assault on that element of our freedom to own our data, to have that access to that cohort of data that might push us away from a vaccine passport or a forced medicine? Or does that have a part in any of your technology?
No, I think you're 100% right. I mean, it's been one of our foundational values that we're not doing that. In fact, we got asked to participate in some of the vaccine passports, and we said no because we didn't believe in that. And the reason being is exactly that. If they're going to have something that tells me I can't walk into a restaurant or whatever, we don't want to be part of that. And there's a reason all these sci-fi novels end up in dystopian worlds versus utopian worlds. So that sovereignty was been a key aspect of ours. Why we use a lot of blockchain methods underneath the covers when we talk about identity and credentialing and the data. In fact, our user constructs are crypto wallets. Think of them as data crypto wallets. That's how we provide our customers to build apps. That's what they use. And the reason being is that we don't think we should even be able to see data in the systems that are on our platform. We can't see data. I can totally administer the nodes on the system or help operate those nodes and protect the privacy. I can't see data. And we think data owners ought to have that right. And I think that's the fight, because be it central bank digital currency versus distributed, cryptocurrency, the same is going to be with our identity and our data.
That's awesome. I was going to ask you how you protect individuals' data. I was also going to ask you, under the hood, is this your own AI that you guys homebrewed, or are you using one of the popular models? Or
well, there's two parts to it. So we kind of look at ourselves as the plumbing platform. So we put data in. We organize data in the way that people think. So you can see patterns in the data and the way machines think that feed, a lot of the learning models. So we try to be independent of the actual AI models themselves. But how we build the graphs and the data relationships, that's some of our tech in terms of our underlying AI and building those associations and the knowledge graphs. But we always felt that there's going to be so much movement, just like at the layer 1 blockchain level and the protocols. There'll be so much movement and so much advancement, in terms of power usage or however we want to call it. Same we said with the AI, that we want to be the in-between layer. We want to be the system that lets people be stewards of themselves. And that's where we play.
Nice. So how do you protect? Oh, sorry, go ahead. Yeah.
I think the other piece of it too is that when we're looking at AI systems that need to consume data, one of the biggest challenges that we have is that oftentimes they're consuming just anything and everything they can find on the internet, right? And they don't really care if they have the right to that data or not. I find it, I can use it. And so part of what we really believe in is, if we really want to realize this vision of ethical AI, you have to have these underlying frameworks that say, is the data trustworthy? Do I actually believe that the data is true? And do I actually have the right to use it? The AI, right? So all of that requires a foundational data layer that says, who owns this data? Did they give this AI the right to use this data? And does the AI look at it and say, yes, I believe that this data is actually true and it's not just some fake thing that I found? So that is really sort of foundational to how we support AI systems.
Yeah. So you're the middle layer, and you're utilizing other AI models. And you guys can't see the data, but obviously the AI needs to see the data. How are you protecting individuals' data from the back end of the AI, where they're hoovering all that data up and might save it?
So go ahead, Frank.
No, you do.
Well, I was going to say, at a most basic level,
if
you own your identity, you own your knowledge graph, your life graph, right? You say, I want to use this app that I found, and that app has an agentic service agent that's going to help me navigate my chronic care disease plan, right? My management plan. It has to disclose to you, right, that I am using this AI agent to provide you with this care. And here is all the data that I am requesting access to in order to provide you with these AI services. you can then opt in and say, yeah, you can have all of that. You can say, no, you can't have any of it. Or you can say, yeah, you can have this and this, but not that and not that. So really what owning your knowledge graph allows you to do, whether it's at an individual level, like my personal knowledge graph, or whether it's organization to organization, is it allows those decision-making and that governance to say, what am I going to allow this AI to use? And do I benefit from that? And how do I benefit from that? And how does that impact my decision?
Yeah, sure. So I've been thinking about this for a while, and there's another step in my decision-making process, at least, or in what seems like the overarching decision-making process. It's not just what data do I feel okay giving them access to, but what permissions am I giving them to use this data for?
Yep.
Like, because I'm hoping we get to the point where when I allow access to my data, it is contractually, legally enforceably only for certain purposes.
Yeah.
Correct.
Otherwise, they will get that data and they will give you the service, and then they will keep that data and use it for whatever the hell they want. It's theirs now.
Correct. And that's part of what that's part of what LifeGraph and blockchain really enforce. That access is only provided for this one specific use case, for this one specific purpose, this realm. All of that gets defined within the data layer itself. So there is no mechanism for systems to kind of go rogue and use it outside of what it's actually been consented for.
And what you identified is the primary problem on the research side of life. A patient provides consent to be part of a research study and certain data, and now they want to use the data for something else. So on the back end, they start going through this legal wrangling to be able to use the data for something else. But they're supposed to go back and get primary consent again. They have a difficult time doing that. So they circumvent those processes.
Yeah.
And what Amber's talking about is, kind of our core beliefs, this get a little geeky, is that we like to put the permissions and security in the data itself, so it goes with the data. So this is where kind of blockchain and Web3 stuff, we turn data into digital asset. So it's the data value, it's the metadata, it's the permissions and the ownership. All that's encapsulated in that cryptographic container that can be presented as in different standards and different formats. So if it's disconnected, the security of that data object doesn't go away because it's with the data, itself. So it gives the ability to revoke it. And there's good emerging standards associated with providing that tailback and the authorization, particularly like in verified credentials and other things that you can use in really kind of a blockchain view of a distributed autonomous kind of organization and management structure. And that's been the goal. And you talk about getting pushback. We've got a ton of pushback because current healthcare vendors don't want that. They want to own their island. We don't live on an island.
Yeah. Now that said, what you're working on here and anything worth doing is never going to happen unopposed, basically. But what you're doing here doesn't only harm them and their model. Like you talked about it being difficult to go back and get secondary permissions. But when this all becomes data and programmatic, it can actually be quite easy to then sort of ping those previous users. You can actually be offering streamlined access for certain things that were difficult to do because it was very hand cranked and paperwork oriented.
Yeah. And building those cohorts is one of the most difficult things to do.
And with compensation too.
Yeah, and add compensation because it's, there's a monetization realm. You got to figure out what's the value of a piece of data. But if it's my DNA that all of a sudden drives a certain clinical breakthrough, I should get something back in some way. So that those are some of the go forward challenges: is how do you monetize it, and then how do you build critical mass? I mean, it's been the same issue with digital identities. I mean, if you go back about 4 years ago in the crypto and the blockchain space, you had this whole kind of wave of people doing digital identity and want to be a digital identity provider. I don't care if it was Hyperledger, even Hedera or Sovereign or a whole bunch of others. They all kind of hit the market and started out in kind of the crypto buzz, and then it just flattened. There's been no movement for the last four years in any significant way. So the question is, are we at a point now where we can really effectuate a critical mass on that element, regardless of where it comes from, and have it be interoperable across lots of domains to where the rest of the stuff can flow pretty easy.
Yeah, and is there a bit of a chicken and egg challenge here, where we would love the policy to match what is technically possible, but we might need to build those tools to show that it actually works? But you are a corporation, you need to have funding and be sustainable. And if the policy doesn't ensure the usage of what you're building, you can't necessarily rationalize the expense to build it.
Correct.
Yeah.
I mean, policy's got to be an integral part. There's a role for government in this, in the policy side, but it's got to be the right policy where you got what you guys are pushing. It's got to be human centric and self-sovereign centric.
Yep.
Yeah, and one of the things that I've been thinking about too is when you're trying to facilitate large scale industry transformation, you really need to gather the relevant stakeholders together and have out those discussions around what the ideal outcomes kind of look like, what the challenges that the current system is facing, what solutions might look like, and have that group process towards moving or transforming it. Because I can just imagine, like, if you were to roll in to the stakeholder room and be like, we have the solution, this is how the solution works, fuck you guys, like, they're just going to be like, no, and not going to participate on that realm. But if you can bring together these different people, and maybe like Bobby and HHS can help be facilitators of this, or maybe it's because there's many different groups that are all represented in here. But at the end of the day, what's the ideal outcome that we're looking for? Personally, I think it's having secure, effective access to data, reducing the fraud, reducing the waste, and enabling better health outcomes, at a national, at a state, national, and international level. Because the other thing is, like, done properly, this isn't just a national solution. Like, this becomes a borderless solution for data, health data, which I would imagine that a lot of lives have been lost over the years of travelers being in foreign countries and there being bad information or no information about injured or sick patients, and more open access to data, a consortia or open standards that could solve all that. Does that make sense?
Yeah.
Yeah.
Yeah, it does. I mean, I think we're at a convergence.
Mm-hmm.
It's cool. I mean, from the tech side, it's at a good convergence that we talk about all this geeky data stuff, but the usability of what it means, particularly with how quickly the agentic space is moving. If you can couple, the privacy aspect of data with the power of agentic usability, and I get, in essence, my digital twin that's me, that the government doesn't own. I think we're at a point to where we're at a bunch of crossroads here where the right policy would enable that. And particularly if we pick it in a given area, it could be health, it could be food supply chain, it could be pharma supply chain, it can be any of those things, it can be fraud. It just needs one place to be demonstrable.
Yeah, and you said the right policy. In that same place, the wrong policy gets us a couple steps farther down a much darker path.
Yeah, that's that dystopian world.
Mm-hmm.
I don't want to live in that world.
Me either.
And Frank, what do you think is the lowest hanging fruit, or what would be the most politically appropriate or effective issue, challenge to focus on?
Well, if you kind of look at some of the priorities coming out, Bobby's broader priorities, one thing he talked about is the mess of getting access to data just within HHS. One group has data, another group has data. They're going to charge each other to get access to the data. They're going to control it, but it would effectuate a whole lot of transparency, therapeutic discovery. So one fix that problem. That's an internal problem for the agency. The other part is talks about what's in our food supply. That whole supply chain issue should become a heck of a lot more transparent across the board. And we see a lot of big corporations starting to commit to removing things from food supply. And then I think the last the third thing, now I'm lost my train of thought with supply chain. I think it goes back to the pharma supply chain. Those are things that can be tackled within a controlled ecosystem that doesn't require all this broad brush. And then the last with DOGE and fraud, waste, and abuse and driving costs out of the system. I think focusing on some of the fraud issues, without crossing over the privacy concern, I think that's an easy thing to do. But it's funny in the health space, like we talked about that state we did the analysis for, what they said, we'll get to it at some point in time. $400 million a year, it's just crazy. So it's just sitting there doing that. And we've seen
benefits from that fraud.
Yeah. And we've seen large systems in previous lives, health systems where you say, you could take a couple $1 million a month out of your operating costs or improve efficiency if you do these things, and say, well, it make my employees unhappy. I'm not doing it. So there's a mental set there, kind of that corporate immune system that has to be busted through, but fraud's an easy one.
Well, I'd say that seems like one of the opportunities, but also challenges of this kind of transformation this is like properly rolled out. This is very transparent, very accountable, and very streamlined. So there's probably a lot of, for the value it creates, there's probably potentially greater value that's being destroyed. And when I say that value destroyed, that means those are jobs that, just don't necessarily add any value, are just kind of are drains at the net level.
I'll give you one more example, Kyle, when we talk about some of it, and it may not be fraud. When we talk about over and under payments, on the Medicare side of life. So I paid a Medicaid provider, somebody's managing somebody's care. I paid them too much, or from their perspective, you're not paying me the services I'm providing. We had one of our partners that had an amazing solution to look at that. So when they approach our customers, say, we want to know the underpayments, but please don't tell us about the overpayments, because then I got to go get rid of them. So again, it's part of the culture and the system. It's kind of crazy, but that's part of the busting up of this syndicate.
Yeah, well, you guys are in the crypto space. You know a lot about the phrase alignment of stakeholder interests.
Yes.
Right. Yeah, that's a great example of misalignment of stakeholder interests. And there's a lot of that in the corporate world, and even in the nonprofit world. Weirdly enough, you get a massive nonprofit working on an issue, and now it's also a giant organization and a bunch of people's livelihoods. And there's a perverse incentive not to work themselves out of work.
Yeah, absolutely.
Yeah.
I think from my perspective, I think about it not so much in terms of, can we sort of trim people, so much as can we give people the tools and the resources that they need so that they are doing work that is at the top of their skill set, instead of having to do work that is at the bottom of their skill set and can be automated. And so fundamentally, it's really more about allowing people to do better, more efficient work than it is anything else.
Yeah, it's probably the right message for you to tell. But once these AI systems are mature enough, it will reduce headcount at a lot of organizations.
It will. And if birth rates continue to go down, that probably aligns with our workforce.
Yeah. Indeed. It's a very interesting hinge point, pivot point we're at in our civilization. And you guys are clearly working on some of the stuff we need to do with the right vision in mind for us to go down the light path rather than the dark path. So I'm pretty stoked.
Yeah.
Speaking of the
there's a
dark path, I have a question. So you guys might know about the 20 and 23andMe deal. I got those boxes in my house and read the fine print and determined years ago I was not going to do that. They claimed bankruptcy. That's like the ultimate data. The co-founder, Ann Wojcicki, has launched a nonprofit and won the bid for that data. So the co-founder of 23andMe was hoping to, well, I was hoping, and a lot of people were hoping that that data would be kept private, is now in the hands of her in a nonprofit. First of all, what are your thoughts on that in relation to, is there good stuff that can come from that, or is that kind of an evil thing? And being that's the ultimate data, is there any way to lock that stuff up either on a blockchain or in a token or something so that we can have greater control over the ultimate data, our DNA?
Yeah. I mean, it's an awesome question. I mean, because some aspects of it, I mean, get into the tech, was it full sequence or not, but it's enough. And most people didn't understand they were consenting to give them rights to the data when they did the test was just ancestry. It's kind of like getting on social media and then a now picture. You just kind of help improve in facial recognition. I think it's a gross violation of individual privacy in so many different ways. Not only that their monetization wasn't selling those kits, their monetization was always selling the data. And that goes with ancestry.com as well. That's the primary monetization. And so jamming it into a nonprofit, there's a lot of value in the data banks, genome data banks, and even biobanks, but people should be able to opt into that, not just, oh, now I own the data because I won a bid. I think it's terrible.
So then on the next point, when it comes to like in this new realm, where is the data stored and how does it get forgotten?
Yeah. I think there's a couple aspects, and that's part of what we worked on, since we say we use blockchain methods because we don't do layer one stuff, the true immutable transaction layer. We use the consensus methods and cryptographic ownership methods to enforce kind of privacy and ownership of the data, but you have to have the ability to delete it. And there's lots of ways and techniques to do that when data is encrypted without dealing with the broader integrity issues. Again, not at a layer one. So you have to in a couple of things, we call them secure data zones. So direct where it's stored, but eventually we're going to hold supercomputers in our hands. Why shouldn't it be with me, both in either on my hand or my own little personal cloud? And I think that's where it's going to be at some point.
Yeah, and even the AI models will hopefully be mature and sophisticated enough to be client side, so that everything is staying right there with you.
Correct.
Yeah.
Yep.
And then I guess one of the other kind of questions that I've kind of encountered is, if I am owning my own data, what happens if I'm incapacitated? Like, how can, like, if that needs to be made available, is there? And I know, like, in Bitcoin, you have like a multi-sig arrangement where, like, I might hold a key or even two keys, and then my doctor might hold a key, and maybe there's like the emergency authority that could act as that extra key.
Yeah, so you can use those same crypto methods with data and really have basically custodial controls over. So for example, health information exchanges are a good example of this. Most states have an HIE, and those HIEs, part of their job is to make sure that data is available should you show up a facility that doesn't have your record. So those kinds of methods that are used in crypto, like multi-sig wallets, same kind of functions can happen for data. The nice thing is, because you're using blockchain methods, because everything is transparent and auditable, when those break the glass scenarios happen, there's a full automatic record of those events. So you can actually go back and see exactly how it was accessed. And you can actually limit those scenarios to say the only time a break the glass can occur is if the individual or wallet that's trying to access the data has the appropriate credentials. For example, is a board certified ER physician. Those are the only individuals that can break that glass. So you can apply all of that governance and enforce all of that pretty easily within the system.
That's interesting because it also would essentially create within that chain of data an immutable record of who accessed it and how they accessed it and what they did with it.
100%. Yep. Automatically.
Yeah. And this gets into things like smart contracts too.
Yep.
Which has to do with not just those sorts of interactions, but also at the policy level. And I think a lot of folks who only know about like crypto as like Bitcoin or Doge or shitcoins or whatever, don't really know much about the idea of smart contracts, which is super interesting when you think about policy. Because right now, you can pass all the laws you want. A lot of these giant organizations will just break the rules that they can. And often, even if they get busted for it, they'll pay a fine or a fee. They'll admit no wrongdoing. It's a line item in the budget, and it's still profitable to do so. Yeah. But if the policy is baked in at the software layer of how these things operate, and there's sort of like human readable language about what is happening when you push the OK button, you get a lot closer. And this gets into terms like trustlessness that have flown around the blockchain community for a long time. I think it's a really I don't like the term because people hear it and think something else, but it's just abstracting trust to the contract itself, so that when you agree to it, you know exactly what it's going to do, and it can't do anything else. So you don't have to trust beyond that.
Correct.
So it's almost really trustfulness, but trust in transparency and in anything outside of the given parameters does not compute just by nature.
Correct.
Yeah.
And I'm going to put on my fake lawyer hat for a second. A lot of the organizations that we talk to are so focused on, I have to have paper contracts, and all of my policies are on paper. Even if it's e-paper, it's still paper. I have my legal contracts. I have to have signatures on paper. And I have these digital repositories of every single contract that I'm signing. So data sharing agreements and data use agreements, all of these vendor contracts, all of that are sort of in these very traditional legal contracts. What you're talking about and what smart contracts do is take all of that and enforce that directly within the data itself, so that you can take all of those policies and now you say, I don't just have to say like, okay, if I go on a website and they say, here's what we're going to do with all your data, the only way I know to believe them is because that's what they committed to on a piece of paper and that I could sue them. That's the only ramification I have. Yep. But if it's actually embedded in a smart contract, to your point, I know they can't do anything else with it because the smart contract won't allow it.
Yep. Just does not compute. Yeah. And just real quick, I want to go back for just a second and say that it's not just fraud and malfeasance that is problematic with the way policy currently works. It's also just that in order for us to execute the rules we choose to do business by or governance or whatnot, it's an incredibly large administrative burden. So not only does it take a lot of tedious, mundane work, that's also a ton of surface area for human error.
Correct. Yeah.
And I'll just say too, like, we're talking about this in the healthcare spectrum, but this same general kind of architecture can also be applied to other industries. You talk about food safety, supply chain management. Like, I remember talking to Health Canada many years ago about, helping understand blockchain, where the future might lead to. And one of those was, this idea that, if you have competitors sharing this basic infrastructure that they're all relying on it for in the case of like a food outbreak, like being able to drill in very directly to where that was coming from. And there's only an authority at the higher level could be able to open up data to should a company or a participant in the network be like, be guilty and not wanting to participate in open and share, then like, that attorney key, or that like, the general key, the inspector key, the police key, can turn and access. But there is a record of that taking place. And that could also be applied to, CCTVs, for example. Instead of like there just being omniscient view of any super admin, like going in and seeing like all this footage, actually accessing that footage has a record for it every time it happens. Like the amount of accountability that takes place when this technology gets applied at scale can really reduce the opportunities for negative or illegal behavior or nefarious behavior that's capable in the centralized kind of open systems. When you fix the system, you can eliminate the problems at whole.
Yeah.
We have a question. Christina Fitzy typed in, I would love to own my own personal agent or watch that can talk to my doctor if I'm incapable. I mean, I wrote a birthing plan and they violated it. My partner has a birthing circle on Facebook, and we hear this all the time. People just don't know what they're getting into in that world. Just the birthing, just that one element of healthcare. Is there anything that you guys are offering that get into that? I mean, clearly that piece of, it's not necessarily just the data, but it's like kind of the data that you're getting into, the things that you want to have happen. How does that flush into this?
So
I'm happy to take that, Amber.
Okay, I'll take that one. So I think when we start to see the agentic space really become embedded in everything we do, we're going to start to see that really, really take off. That kind of scenario is frustratingly common. And I would say things like, can you have agentic doulas who are actually helping enforce the decisions that you want in that moment? Those things are possible. It's possible today. All of the data is there, and you can use it in lots of different ways. Care coordinators, care navigators, doulas, agentic doulas. There are so many ways that you can have agents that are really advocating for you and enforcing that advocation. Like, they don't have any bias. They don't get influenced by any outside sources. It's an agent. It just does what you tell it to do and enforces that. So I think those kind of things will become much more common. And they're going to become, frankly, in my opinion, I think this is really important, become much more accessible, because a lot of people go into those types of scenarios and most people can't afford a doula, but really need it. And so those kinds of agentic systems are going to be incredibly helpful for health equity, making sure that people can get access to care, making sure people are advocated for when they can't advocate for themselves. All of those things are possible when agents are really, acting as your personal agent and on your behalf.
I see Johnny down there.
All right, Damo, thank you.
Get in there, buddy.
Johnny!
All right, so I love this idea of data sovereignty, right? This is so important. Data is like the new oil. It is so important. But, we've got all these corporations pushing all this money after it. And, I like this quote that the corporation is just, a clever way to shield these, entities from accountability. And when we have a free market or when we have competition, I should say, these people who are really pushing their edge, pushing their advantages, they're going to be more apt to prosper. So, yeah, you talk about the policies and how we can make it, the rules we need in place for everybody, but it's like, man, I don't know. It's just, gosh, I'm so cynical. We see the corporations getting away with so much in so many different ways. So, I think this is such an important conversation. And then, yeah, I guess so. My question is just, what exact policies do we need in place? And then like what groups are really, pushing for this, protecting our data this way?
Frank, you want to take that?
Sure. Well, I think if we take a step back, given the acceleration of what's happened with AI over the last 2 years, and we revisit what started out with things like GDPR, right to be forgotten, and transparency. Those all need to be modernized, kind of at its core. So I think that's one foundational thing. I think from a health perspective, as a person, the HIPAA rules, we need to really take a hard look at the HIPAA rules and what they actually have enabled, versus what they intended to, I should say, disabled versus what they intended to enable. So those are, to me, two starting points: the broader privacy rule, because in the United States, I think it's going to be extremely difficult, given the political environment, to get any kind of national policy on the privacy stuff through. There's been lots of attempts. So you see states popping up doing it, and which again makes it fragmented. So that policy on data privacy, I think, has got to be first and paramount, which extends to health and HIPAA. Who's doing it? There's a lot of independent organizations that'll push. In fact, when things start coming up on centralized, there's a number of independent organizations. But I think, to bring it back to this context, I think it ought to be something, should be part of the Maha rail in terms of what happens with our health data, and secondarily, what's the policy around AI and my mental health, and all that ethical use of all that stuff is all wrapped up in my own personal health too.
Here, here. Well said.
And who are some of the leading jurisdictions that, right now? Who's kind of the best in class? Who are the leaders in this space right now, would you guys say?
Well, it depends on. California was actually one of the first ones to do it.
Yeah, that's what I was going to say.
Do I necessarily like their legislation 100%? No, but they took a crack at it. And Colorado, I know, here is trying to do it, and there's a handful of other states that are pushing it pretty hard. That I think you're going to see more of what are traditionally kind of the red states starting to step into this game, kind of Florida and Texas and a couple others.
Frank, was it Delaware was the first state to make you an actual legal owner of your data?
Correct.
Was that it? Yeah.
Correct. It was Delaware that said person is actually a legal owner of their data.
Mm-hmm. Which is a big deal. And I think the more that we can start to propagate that to other states, then we're going to see a lot of breakup of the kind of, big tech ownership and control of that data. I think regulation really has to be a big driver of that, because otherwise organizations don't have an incentive to let go of control.
Yeah. Hey, there's one thing in the comment I want to address when we talk about WEF and Davos. Our first
going to say it.
Yeah. Our part was when we first showed up there, that was when the crypto community descended at Davos. And at the time, we were taking a position of all the things we're outlining with our policies and our views on individual sovereignty. I could say we were a little bit ignorant on some of the broader issues that those guys were pushing. Our alignment was with the crypto groups that showed up there.
Yeah, similarly, I remember going to Davos in 2017 as part of I feel like there was a huge crypto influx that kind of came in a disruptive open source attack, not officially part of everything, but there was this whole side events where literally trying to decentralize Davos.
Right. Yeah.
And guess what? It turns out, we weren't welcome in the official halls, but oh my goodness, we were at all the outside events, in force and talking and explaining and exploring, because there's so much innovation happening. It's one thing for policymakers to actually discuss things and master planners to discuss where they want things to go. It's another thing where the actual innovation, where the development's taking place. And from that side of it, it's nothing can there's so much real energy and heart behind trying to actually solve these and transform it, that I don't think there's anything that can really stop this. I would like to see, something like to the scale of almost like GDPR, but for like, owning your own data. And maybe that's, another approach. And maybe that's something that, the Maha movement or the Maha warriors and the mega too, and just basically just awake, health conscious, Americans and Canadians towards this own your data movement. Like, it's not there's privacy problems, there's actual danger towards us not controlling it. So that could be the other angle of attack, is if you have a treaties or a general policy kind of umbrella or a bill that is saying we're going to go towards this. And it'll take time, and because you need to give time, because these are big systems, they don't transition. You can't flip a switch and change it. But 10 years, are we owning our data, Frank? What do you think?
Yeah, I do. And I think there's two ways to attack it: from the outside and from the inside. And so, we need warriors on both ends of the spectrum. I'm going to give you an example of going back to that Davos thing. That's actually where the first time I met Kyle was during that window. What happened was a little group formed out of there that started pushing crypto policy for smaller jurisdictions and how to broader adopt, a lot of the decentralized policies in the crypto space. It culminated, there's a group that's kept pushing that forward, fighting from the inside with OECD and through some of the financial regulatory bodies, that some of that legislation is now being fully adopted by the British Commonwealth group of nations, as well as a lot of other jurisdictions. So it's possible to effectuate change outside and inside. I think we have an awesome opportunity with this administration to do it from the inside now, not just the outside.
I'm actually trying to pull up the picture, Frank, of us at the OECD. Oh man, this was a good time.
Always kicking myself that I didn't quite make it to Davos. That sounded like it would have been a fun little muckraking experience.
Well, it was fun considering we all stayed in a big old house too. That was pretty fun. Oh man.
I have a question on
a bunch of legends. You guys were in Switzerland?
We've been to Switzerland. This was in Paris. This little clip right here.
OECD was Paris, yeah.
I remember that picture.
But there's Frank right there. He's doing a point. Look at all those doges. God, it's so funny.
Kyle, you got to take. I'm going next time. That's end of story.
Oh,
all right, I have a question on AI. AI, as we know, is disrupting quite a bit. College grads, jobs in tech in the top 15 tech companies dropped 50% since 2019 and 25% in 1 year, 2023 to 2024. Bill Gates has said your doctor is no longer be needed. AI will tell you what to do. I think that scares the hell out of us if the AI model is trained on, one size fits all medicine. So it's kind of a multi-part question of, do you have any recommendations for the younger generation? I think healthcare is a major aspect of our lives, as is the service industry. So whether it's being a plumber, working on a car, building a home, learning how to fabricate, that hands-on thing, getting outside is a big piece of it. And I think healthcare is going to also be a very big piece of that. What do you feel about the AI aspect of medicine, particularly that part of diagnosis, recommendation, prescription, that element? And do you have any recommendations for the younger generation in this space?
Well, I'll attack it once and let Amber jump in. So we have a really cool partner that we work with. It's a university that have a pretty substantial nurse graduate program. And so the guy there, he's extremely visionary. He says 4-year institutions aren't going to exist in the future. It's lifelong learning, it's learning companions, and we've always talked about collaborative intelligence. And we think that's what's going to happen in health space with Health Buddies, because you're a population of one, not 300 million. You are you. And, you know, we see this in even some of the studies on twins. Well, they could be identical twins. As they grow, they change. They're not the same, right? So I think it becomes an augmentation. And one of the early things that we did in terms of trialing is with our partner, Maryville University. They created a nurse companion to help nurses through graduate programs. So they reduced the dropout rate from 50% down to 7%. And then we started extending it to preceptor companions, so virtual preceptors to augment real preceptors. And a preceptors is a nurse mentor for new nurses. Each new nurse has to have a preceptor. We don't have enough of them. We're going to be 5 million nurses short coming. I'm just picking on nurses worldwide in just a few short years. So having an augmentation to that, we see as a very, very viable thing. As a primary diagnostic tools, it's just too complex. I don't think we're going to see any of that in the near, you know, even with the rapid rate of adoption. I think it's going to be a guide tool to increase the efficiency of somebody who's really smart in the health space and help me personally.
Yeah, I think Frank caught it. I think the only thing I'll add is that, you know, it's really important to have kind of what we call human in the loop systems, AI systems, so that you have checks on all of the recommendations that an AI is making. And I think in the health space in particular, the best advice I can give to any person, young or old, is to self-advocate. And you understand yourself better than any person or AI system on the planet. If you can have an AI in the future that is your personal AI and understands you and what you want and what your vision is and how you want to manage your own health, but also understands best practice, what current research says, all of the clinical diagnoses that you have and the implications, and what outcomes have been for millions or billions of other people, that is a really powerful companion to have. And if you can manage that companion and have that companion to help you navigate through the healthcare system, but then have yourself, your human in the loop, that's really ultimately making the decisions about your own care and your own data and how you want your life to be managed, that's the most powerful we can get in terms of personal autonomy and personal control and ownership of our whole health experience.
Yeah. And the last thing I say, advice, young person, I mean, I look at his 4-year institutions, you know, we get 8 years down the road, is it going to be valuable? It's a lifelong journey of skills development, and AI is going to be part of that journey for you. Mm-hmm. So embrace that now. And, you know, I'm not the first one to said it, but, you know, the world's not going to necessarily all be replaced by AI, but people who use it, even in the hands-on work, in the design and engineering work, and even the physical construction of stuff. I think it ends up materializing there. And then back to the policy thing, when we talk about AI in medicine, this is a key policy under the FDA. Software becomes a medical device when you start thinking of AI providing real clinical diagnostics. How do I test the efficacy of that AI? So we're doing one test with a pharma customer with one of their therapeutics, where they're just open sourcing the AI and saying, okay, whoever can provide the diagnostic tools for this disease, we want to validate the efficacy with our docs. And I think that kind of policy and process to fast track those things is going to be extremely important in the near term.
Yep.
And then I guess one of the other things is, what about like with your children and, you know, managing their records? As a parent, am I going to, like, you know, in this own your data realm, am I the custodian? Am I the guardian of the children's data until a certain point when they take keys? Like, how's that going to work?
Oh, you just hit a pretty sensitive subject, the parental rights.
Yeah.
I don't know where you draw the line. I mean, there's a certain point where you are the caretaker for that child. So yeah, you're the caretaker of them, you're caretaker of their data.
And why is that a sensitive subject?
Well, we see it getting, you see the battles at a certain age where, okay, a school's not going to tell the parents about certain things that are happening with their kids, even minors. But is it a parental right to know that or not? So yeah,
we work in states' rights, and this is what I call a states' rights civil war. This topic is coming up in states, and it's currently coming up in Massachusetts right now. They're fighting religious exemption, and they're currently fighting the idea that a 14-year-old can present and the parent can be kept out of the doctor's office while the child goes in and gets directed in any way by a doctor. And parents are potentially losing this rights. And in some states, it's already there. I testified 2 years ago on Capitol Hill here in DC to vote against being able to do that to a 14-year-old, so that a 14-year-old could consent to a vaccine without parental consent. And part of my issue was that that child might not know the allergic reactions that their parents have or other people in the family, or might not understand things about the inserts in vaccines. So that aspect is, it is a very sensitive subject right now.
It's a big topic in Colorado right now with some of the legislation.
Yeah.
Well, guys, I feel like we've covered an awful lot here, and I just want to say, how grateful I am to both you, Amber and Frank, for kind of showing up. And I mean, we want to offer kind of some closing thoughts and some closing words. We've been going almost an hour 45 now, and might be time to we've unpacked a lot here, to lots to think on and sleep on. What do you think, Johnny?
I got something real quick. I just want to say, we talk about a lot of people losing their place in society as far as, economics and making a living. And then we talked also about, touching on the fertility crisis, how we're losing so much of our population. I think an answer to both of those kind of lies in, the idea of safer food that we're growing in our own communities. We can get back to plant in paradise curing that fertility crisis, and that comes with employment, that the tastiest meals that we can create locally and with responsible endeavors are gonna cure a lot of these problems that we're seeing about what to do with ourselves and our health as well. So
Getting some jungle leg right there, Johnny. There must be some clouds interfering with your Starlink. But
all right. Sorry about that.
Message received. Paradise is beaming in from paradise right now.
I think I see Yoda behind him, actually.
Yeah. Well, my two things, and this is encouragement for you guys, is just on one thing. Technology solves some problems, but we're still people. We can't forget the human dimension of life here, and what that means, even with all this cool tech coming around, both positive and negative. But the other part is, I put my Maha hat on and I walk around. Everybody is extremely positive. I love your hat. I love your hat. I love your hat. I've yet to get a negative comment. I've yet to get a negative comment.
That's
with that hat, because when you talk about ground roots, it is the individual, it is the families that through this process have become educated, that are making better quality decisions. I just see it with all the folks I work with my kids and my grandkids. It's making a big, huge impact. And again, I don't care where I go, people love the hat.
Get your hat at clubmaha.com, guys. It's right there. Use promo code broccoli emoji for 20% off.
Well done, sir. Amber, any thoughts?
I think you guys, that this has been a great discussion, and I really appreciate the dialogue. And, we're really committed to solving some of these really massive challenges in the healthcare sector. And there are so many different facets to it. And, there are a lot of ways of looking at it. And I think ultimately, what we do as a society and what we're really good at is talking about it and collaborating and seeing different ideas and sharing those different ideas and listening really thoughtfully. And the more we can do that, the more we can understand each other, the more we can come together and find ways that really bring the best of all of those perspectives.
And what kind of clients, are you guys looking for right now? Like, how can we help? Like, what's a value add for anybody right now who's listening? Is like, I love this Burst IQ. We want it to succeed. How can people help support? What does that look like?
Well,
Call us, burstiq.com. Give us a call.
All right.
I might just do that. I have
and
taken
ask your providers how you protecting my data.
Yeah. I think, regulators understanding what's possible, what technology can do, regulators responding to that and starting to think about how policies can really shape this industry in a positive way. That's huge. For us, for our customers, I think, we work with governments, both big and small, and enterprises that are really looking to do technology in more innovative ways and to really get to the future of what healthcare looks like. Those are our clients.
And if
Yeah,
you do
and
something in Maha around tech, come see us because we'll get you started faster.
Yep.
And are you open to clients outside of health and healthcare?
Yes, absolutely. Yeah.
Great. I might want to have a conversation sometime.
Yeah.
Always open.
Call them, Demo. Got it. But and then I'd also say, I would encourage everybody on the health side of it, reach out to your congressmen and your senators. Don't demand anything from them. Simply ask them, have you thought about this? Because I feel like, the elected reps are always dealing with a lot of flamey action. So maybe if you came with hey, I'm your constituent and I'm just curious, have you given much thought or looked into this? Just leave it as a short, nice little question. Wait, you get a response. Let's start seeding, planting seeds. We can't have a harvest. First you got to plant seeds and tend them a little bit. And that's how we'll help nurture our relationships with the representatives, with the policymakers towards seeing this kind of transformation, because this is not, like we said, this is not a flick the switch type situation. This is a gradual and iterative process, and impressions, discussions, touch points, reflections, share the news. You hear about that Burst IQ? They're doing some really interesting stuff in Colorado. Well, they could maybe do it in Florida. I think they could do it at HHS in general. That's what I would like to see. And Billy right here.
We'll come back and talk to Billy about state.
BC. He's out there. He's
Let's
whispering.
Yeah.
I don't know if you guys seen the Game of Thrones, but there's a guy named Varys. Basically, Billy right here.
Oh man.
I'm kidding.
There you go. All right, let's work for Burst IQ to have their first token. And when you go in public soon?
No tokens.
Oh, I'm game. Token. Blast.
Yeah.
It'll be a blast.
Talk to Kyle. He'll help you with the token. He'll get that thing right up.
I mean, I think that it's around kind of align incentives for the industry and what the purpose is. I think there's role for it and awareness, but at the larger meta here, it's how can we get Bobby and the HHS? I'm sure they're already thinking. I mean, you look at ARPA-H, what they've been doing, right? This is all on their radar. This is nothing new. They're thinking about all this. The question is, are you guys inside enough to actually, be a vendor, that is the solution, or is it, the cozy crew that gets in there? But that's why we work with the big SIs too, right? Or is that SIs? Yep. They're the ones that are going to, take this engine and and the tenets of this engine, I think are clear. The requirements like on that to implement the solution, needs to check these boxes. And just in that little video we watched at the beginning, it's check most of the boxes. So that's great.
Yeah.
You guys are fun.
Yeah.
Yeah, this is good. This is great.
This was a lot of fun. I'm glad you guys came in. I really appreciate it.
Keep doing what you're doing. We're rooting for you too.
Yeah,
Do what we can.
keep in touch with us. Let us know. Let us know the new things coming down the pipe. You guys, you're our AI experts in health.
Awesome.
Yeah, we'd love to know.
Anytime.
What's going on.
Well, all right, guys. Well, thank you so much, Frank. Thank you, Amber. I'm gonna drop you guys. Thank you.
Thanks.
Oh, she was saying thanks. See, Frank.
Much love, man. Thanks a lot.
Thanks.
Mahalo.
Woo! Well, guys,
Maha hi.
mahalo.
That was great.
Yeah, that was a lot of fun. I'm glad to see crypto literate, crypto values like our OG tribe, Kyle, values aligned folks that are here on the forefront of AI and working in civilization systems. Essentially, they're not entirely outsiders. They have clients that are government. So that's
they're
glad to see. Really,
they're not a startup. They've been working for a long time and
Yeah.
deployed revenue generating, employing, solving, implementing solutions.
love to see it, man. Thanks for introducing them to us.
Yeah.
Yeah, it's one of those conversations you're thinking like, oh man, this could be boring, but like what a great duo they are, and they got the right answers, and they've got a mission in a space that could seem like, what are we going to talk about? But it's really kind of fascinating when you think about all of the issues we have within healthcare.
What the hell?
Talking to you, Mumblewick's talking to you, Damo. All those.
The guy's been jacking off in his thread the whole night, man.
ding dong. But that's okay, because
Yep.
that's what's
Yep. He gave up. That's fine.
Never give up.
Never surrender.
Don't give up. Don't give up. I want
Those
to
millionaires
say,
become millionaires in their 50s. Don't give up. It's coming.
thank you, Banana Rhett. Love you. And also, there's something else. He got his Maha hat. Thank you again.
Hey, happy birthday, man.
Today, an angel birthday to Rhett. Let's
Happy birthday, Rhett.
Got to run naked through the quad.
Shout out to Frank down in the comments. Yeah, man, we appreciate the support.
this Mumblewick, he left this thing at the very beginning, so maybe he's hanging around and really watching the whole show.
Yeah.
Sitting there like, wow.
Hey, man, keep your hecklers close. Hang out, Mumble. Maybe we'll rub off on you.
Dude, just
Yeah,
come
for
out.
those who don't know what we're
Wednesday,
talking about.
If you want to, get a Maha shirt and cross it out, go to clubmaha.com. Use code banana emoji. Just the broccoli emoji. It's just the broccoli emoji for an awesome discount. Or don't. I wish there was a negative codes. In fact.
Yeah, he's gonna go off and
Here, you use the broccoli. You use the broccoli banana emoji combo, and it's a negative 100% discount. So it's like, oh, it just turned into
just for Mumble.
$200 hat.
$200 hat.
Just for you, buddy.
Can you imagine?
Kyle will wear it for one day. Then you get it.
Oh man.
Oh,
you're going to autograph it too.
Mumble, you want an Edge coaster? $10. Shout out to Edge, one of the great wallets out there. If anybody's looking for a good wallet that, ultimately I was actually talking with Paul Pui earlier today about the need to store digital identity too. And because with what Edge does, it creates a secure kind of data enclave to store your private keys for crypto transactions. There's no reason that it can't also store the private keys to your data chains. and different data and identities. One of the things I'm hoping that he did, and I hope really anybody would do, if there's any cool entrepreneurs listening that want to like actively build and create, build a crypto wallet that allows you to like just take pictures of your existing cards and store it. And I told Paul to do this, like, just allow me to back up my important physical cards into like, a secure crypto thing that I always have with me, just in case, registration, insurance, these little documents. It's handy to have.
Blockchain. Got to put it on the
Yeah,
blockchain.
Blockchain.
Does Ed do iCloud backup
iCloud backup for what?
for their wallet
Like of your keys?
of your information? The Loop Ring wallet that I was using until they shut it down recently. You can do iCloud backup.
Yeah, there's no iCloud backup with it. It's just it's a mobile only experience. And
Yeah, no, the point is like I had to replace my phone recently because the back broke and it was just starting to get janky. So I replaced my phone, and of course in iCloud it's got all of your apps on it, so it just re-downloads all your apps. And some crypto wallets can store your credentials, because ultimately the wallet is just a user interface to the blockchain, which is omnipresent. So it stores your credentials so that when you get a new phone, you just sort of log back in. I think it might have it.
Yeah, I think it might have it too, especially if not like, phone to phone. I know like if you lose your phone and if you're concerned about it, you can like, load up your wallet on your account on another wallet and like basically like, deactivate account to the existing one. Yeah, Edge. It's a really strong one. I actually like I just found this credit card here if anybody wants a number. There it is.
Oh, that's fun.
I got a lot of them.
I believe it.
Drop them. You're just like walking around in the store. Just drop one of these on the ground by somebody.
Just hold.
They look down. They're like, "Oh, I'm sure you dropped this," and you look like, "No, that wasn't me. That wasn't me."
Your mountains of swag, man. Just hold them. Hold it for decades, because I
What?
like 20 or 30 years. That's all collected.
Anybody would want to have a Kennedy is weird exclusive copy of the new Independent.
I want a bundle that still is wrapped from the printer.
Is that new? Did that come out?
No, that's from the campaign.
That's the original one.
We gave out thousands of those.
This
That was
one,
issue 2.
This was
right?
issue 2. Demo the night before the DNC started. The first night we got to Chicago, we came up. We were designing this with Bobby 3 while we were in the bus.
Yep, and I nailed the headline. It was
nailed that headline. Kennedy's
weird.
Conspiracy theorist thinks his family was killed by the CIA.
Yeah, what a crazy theory. That's so weird. All right, boys. That's my bedtime.
Man, we're up against the Masters. All right, Dama. All right. Yeah, no,
you go ahead,
I do
man.
appreciate
I got
those
time for
newspapers. You got to
Johnny.
keep those going.
I got time for Johnny.
Reboot them. Reboot the paper, man. I love the physical feel of a nice
There's something really
tactile surface.
Oh, here's a good one. Things that will be illegal to do with AI: organize a protest, audit the Pentagon, deepfake Taylor Swift, fight voter fraud, track vaccines injuries, secure the border, figure out free energy.
Oh, we already figured that out.
What?
That one's breaking containment, it seems like.
You think so?
I mean, of course, unless it's all bullshit, which it could be, but I just, it used to be that there'd be like 2 or 3 or 4 guys and they would swear up and down that they had free energy devices. And then at some point they would go silent and die. And that seemed like what it would be. And now it seems like there's just a bunch more of these dudes that got these videos, and they've got these crazy magnetic devices with like coiled magnets all the way around them. And they're like, look, man, I can plug this thing in and it just generates power. I'm telling you. And then I can unplug it and guess what? It's still generating power. And it's like, all right, maybe. But anyway, they're not dying as fast, so that's interesting.
I want to believe.
I want to believe.
And I feel like whoever's got that that tech, look at this one, this is good. But I feel like whoever has that tech too, they're probably just like, you know, I mean, you can just run a bunch of crypto miners now, and like, if you have the free energy, are they going to really open it up, or are people clandestinely like, you know, running it and using it?
I mean, some people might, but that's been a whole like YouTube movement for years, is people claiming that they figured it out. And they got their little like garage devices, and that's what I mean by breaking containment. Is it used to be like a couple of guys, and every once in a while one of them would die.
Remember the HHO engines, or like look at
the water engines?
The water engines, like you drill a hole into the firing chamber of your engine, and then you take your energy. So the alternator produces energy, and then you take some of that energy and pass it into this electrolyzer or electrolysis machine that breaks down water and separates the hydrogen from it, and then pipes the hydrogen on demand right into the engine block, and it fires the hydrogen. So it solves the problem of storing the hydrogen, and it's just firing. And like, you know, the theory was it would like reduce your count by like 80%. And yeah, that was one of those really, I remember, I think it was there was like speculation that this was like going to make it, and the engine blocks for like a whole series of GE cars, like, you know, had that hydrogen port right in them, just ready to go, but never got implemented. But Fitz, she's got the engineers.
K Fitz is what's up, man.
Yeah. What an awesome welcome.
Christina was she was my co-host when I was doing the midday Maha spaces.
Oh, amazing.
That's K Fitz, man. We got to drag her ass onto the podcast sometime. She's just hang out with us. She's a good time.
Totally.
She's super fun.
Oh yeah.
Yeah.
Okay,
all right, that's it. I broached the topic, Christina. See you next week.
Yeah, come hang out.
She's been vetting it for months. Just remove all the rest. The concept of coming on the show.
Yeah. Here on my screen, I'm blocking it.
Guys, I got the old school free energy tech. You take some seeds, put them in the ground. They spring up these little solar panels called leaves. They give you food, medicine, energy, fuel. Even. I mean, come on.
I mean, there's a sun too. We forget there's a sun. There's also you. I'm free. I can ride a bike. That's free energy. Really, I'm not paying for it.
If you have children too, you can make them ride the bike.
Dude, that's totally awesome.
There might be laws about that.
I mean, that is free energy. They do the dishes. That's
yeah.
I had to feed them though, so
I am definitely not free.
No,
make kids feed the chickens again.
My kids feed the chickens. They do that.
Johnny?
They that's their job. Yep. Good times.
All right.
It's been all right, guys.
Watch that.
An awesome Wednesday.
Did you guys watch that mushroom video at the end? Like, so like some of you just kind of hung around, but then a couple of you dropped off. Like that fucking video was amazing. Like with the one from last week with the mushrooms of like, you know, oh, let's make surfboards here.
That was cool.
And then I got there's one company that's making a coffin out of mushrooms.
I mean, that makes sense, right?
Right?
We are biodegradable. And so should what we pack our meat suits in when we depart.
And like, you know, and that just seems like be a faster transition into the mycelial earth network.
Oh yeah.
Speaking of
mycelial, a lot cheaper too than a fancy polished poison lacquer.
Right. Totally. Speaking of mycelial networks, we need to start working on the mycelial economy.
Yeah. I'd like some mycelial footwear because I would like to remove the rubber barrier between my body.
You might get fungus foot.
Could get a fungus, right?
Worse than what you've already got. I've seen those feet.
My feet. gross feet. You don't want anything to do with it. That's why I need to be.
Hobbit feet.
As long as you don't wear Crocs, you're okay with me. Crocs.
What? What do you mean? What,
I
what about them?
What do you got?
think they should be outlawed.
Well, all right.
I'm
What
coming
else?
around. I'm coming around.
Medical
Let's
freedom, but down with Crocs.
down with Crocs. Listen, microplastics everywhere with every step. It's no bueno.
Yeah.
My Crocs are super used. Like I was wearing Crocs today, in fact, Billy, and they have a little insert. The kids know what they're called, and they have a name for the little things that go in the holes.
Are they charms?
They're like little charms. The kids said they something because my kids they've got Crocs with them all over the place. But my Crocs actually have a little pizza that says NYC on it. It's pretty fun. Yeah, I'm not gonna shit on your footwear though, Billy.
That
we have a joke in the family about like certain
mental
footwear.
image, though. Kyle shitting.
Don't show up to Billy's place wearing Crocs.
Don't do it.
I was hanging out with Augustus and Stephanie at a cool party on Monday night in DC by John Harrington. Awesome political event. It was like all cool people there. And we were talking about like there was no dudes in open-toed shoes there. And Stephanie and Gus are like, no open-toed shoes for dudes. It was pretty funny. Like it should be illegal. And I was like, yeah, I totally agree. Especially at events like that. You wouldn't want to have a dude in flip-flops walking around.
Next time I hang out with Augustus, I'm wearing pumps.
What about like not wearing shoes at all?
I mean, that is probably slightly more acceptable to me. You know what I mean?
This was one of the things I wanted. Like, I thought, like, after Bobby got caught with not wearing shoes on the plane, and it was like there was so much outrage and it just made so much noise about that. Like, bro, like he was asked we're at the CHD conference in Savannah, and someone asked him the question, like, shoes or no shoes. He's like, no shoes. Like no shoes, doesn't like shoes, would prefer not to wear shoes. Why don't you just not wear shoes? Like it would be it might be a little mimetic. Maybe it's too far, but it's kind of fun.
I'm slightly anal and compulsive when it comes to that stuff. So on a plane, my initial thought is your feet are walking, like your shoes are walking into the bathroom where people are peeing on the floor, and then they're walking back. So my feet will be stepping in carpet on a plane that has urine on it. And so my brain is like, no go on the plane with barefoot, but outside or something, that's kind of different. But like,
sometimes I thought it might just be water that's on the bottom because of those tiny little sinks, but I think you're right. It's definitely piss.
There's a lot of piss.
Oh no, there's definitely splatter everywhere in that little bathroom.
There's water, but
Nope.
there's too, for sure.
No, K-Fit's not toe shaming, just dude
like
toes.
really tall guys like
Just
standing up pissing in bathroom in airport, especially during turbulence. Like, what are you doing? Do the European way. Just turn around, sit down. Come on.
I love it. I love it.
gotta go.
Listen, I'm a tall guy. I'm 6'1", and I got a layover in Oslo. I go to use the restroom. I can barely use these urinals. They're so high. You talk about these tall guys. Oh my gosh.
In Switzerland, it's illegal to piss standing up in your apartments after 10 p.m.
What?
That's
Noise ordinance?
like noise and respect. They just don't do it. They don't do it.
Why don't
Like,
they just not have paper?
Are you
thin-
joking?
no, I'm not.
Like water splashing in a toilet is too loud.
Yeah, why would you do that? You just sit down and you take a pee. Come, it's so loud.
I can't tell if you're true. This is true or
He's
not.
serious.
No, I'm totally serious.
I think
Totally serious.
totally think he's
I
serious.
could bring Brittany in if she wasn't asleep right now. She would explain, like, yeah. There's no, because it is loud. It's like it's loud. And,
It is loud. Actually, yeah, you're right.
you
I
know,
try to make it louder.
Also,
Incremental, I push hard.
it can also be a little bit messy. All right, cutscene.
It is a splashy thing. Yeah. You're right.
All right, Dustin has shared a video. Damo, how do you pull that video out?
Oh man, do you know what that video is?
No, well, that's the thing. Like, again, we were doing this last week when
Yeah, no, I'm just saying
Watch later. It's a long one.
Okay. All right. Deal. Save the link. It's in the private chat for you, Kyle.
But everyone is obviously wondering, what is this video? Okay, guys, this is great. This is the same. This is like the same as last week. You've done it again, Dust. You've done it again.
How cow dung is reinventing plastics and batteries.
Okay.
Oh, it's only 12 minutes, man. Listen.
How cow dung is reinventing plastics and batteries.
These batteries are the shit.
I'm telling you, I want to be a cowboy.
This Matt Farrell. He's pretty fun.
I got a cool looking cowboy hat. I gotta have that handy next time.
This week on Doo Fabrication.
I tell you what,
some shitty batteries.
Yeah. New show on Learning Channel. How shit is made.
Instead of petrochemicals, we just got to get back to composting.
I'm kind of more curious than this guy, NHL star who partied every night and still destroyed. What did he destroy? No.
That's how they get.
Don't do it. Don't do it.
How they get you.
Yeah, if anybody noticed that X has turned into like TikTok and it's not nearly as cool or as fun as it used to be.
I mean, you only get into the TikTok flow if you click a video and then let it cycle.
Click the video, but it's like, they know what they're doing.
Just don't do that.
Don't do it. Don't do it.
Yeah.
Don't click that video.
You guys feel free to hang out, but I'm gonna go to bed because I gotta wake up early and get right back to the grind because it never ends.
It's been good to see you, Damo.
It's always a fun time. I look forward to Wednesdays, you guys.
Oh yeah. All right, time to call it.
Yep.
It's a good show.
Hasta luego.
Good times.
Thanks, K-Fit.
South Park season 27 was supposed to premiere tonight, but it was delayed until 2 weeks from now. Oh, bummer. Wow. Season 27. Can you believe that?
It's pretty epic.
Yeah.
These guys are on top of shit.
It smells kind of funny.
You smell kind of funny.
All right, Damo.
All right.
Enough
All right,
of you.
guys.
I'm just going to remove you, Damo.
Just you know what? I'm just gonna remove myself. Love you. Bye.
Peace.
Bye.
And he's gone. All right, Billy. This is real, dude.
You good, man. We'll see you next week.
Yeah, this is good. Thanks, everybody. ClubMaha.com. It's amazing. Everybody, there's somebody's picking up. I would like to say thank you to, I believe it was Cynthia, who picked up a light Maha and a dark Maha hat just a couple days ago. That's what the light Maha hat looks like. ClubMaha.com. Let's go. Let's grow. See you next week, and we'll see if we can't find up some good guests to discuss potentially the whole mushroom thing, or who knows? We'll see what comes along. Ciao for now. Let's go. Bye. Ending stream. Setting outro video. Let's do our Hannah video. Yes. Farewell.
Hana, adapting ancient traditions into remedies for modern living.